Welcome to the Kids Eating Broccoli podcast, where we believe that raising healthy kids shouldn't be complicated. Our mission is to inspire 20 million families worldwide to take the steps to raise the healthiest generation in our history. We'll interview some of the world's leading experts in nutrition, human potential, and children's health, as well as extraordinary chefs and foodies to gain insight into simple, fun, and creative ways to introduce natural health into homes across this planet. Hi there, and welcome to the next episode of the Kids Eating Broccoli podcast. With today's episode, we continue our special series on ADD and ADHD. Today we have a special guest, Dr. Marco Ferucci. Dr. Ferucci earned his chiropractic degree at Life University in Marietta, Georgia, one of the most prestigious chiropractic universities in the world. During his time there, he was presidential leader of the Chiropractic Biophysics Club, as well as participating member of the Chiropractic Neurology Club. These activities enabled him not only to pursue his own particular interests in chiropractic, but also to teach his fellow students about these effective, life-changing techniques. Dr. Ferucci's passion for neurological development has brought him on the path towards earning a diplomate in chiropractic neurology with the Carrick Institute, fellow certifications in childhood developmental disorders. He regularly attends weekend educational seminars to reach this goal. In addition to this neurological specialization, Dr. Ferucci has also attended APEX seminars, which is a specialized metabolic testing and nutritional support program. Autoimmune disorders such as Hashimoto's hypothyroidism, rheumatoid arthritis, fibromyalgia, as well as hypoglycemia, diabetes, and anemia are just a few of the many conditions Dr. Ferucci helps to manage. Dr. Marco is also an adjunct professor at William Patterson University. He's been featured on News 12's 12 to Your Health, New Jersey TV's Live and Living with Joanna Gages, author of Change Your Mindset, Transform Your Life, and he's the host of Get to the Source with Dr. Marco. Dr. Marco shares with us some awesome pieces about neurology and about nutrition and how these things fit together and can really help our kids who might be suffering with some of the ADHD and hyperactivity situations. All right. Well, thank you so much for joining us for another episode of the Kids Eating Broccoli podcast. Today we get to introduce Dr. Marco to the Kids Eating Broccoli podcast family. Thanks so much for joining us today. And we're going to dive right into his unique story and expertise about ADD and how to help these kids with some of these problems we've seen more and more in our society. So why don't you take a few minutes to introduce yourself and tell us a little bit about your story and what you bring to the podcast today.
Excellent. Thank you so much for having me. I appreciate it. Like you said, I'm Dr. Marco. I'm a practicing chiropractor in New Jersey. But, I always have been into health. It's kind of interesting. My mother always gave me a really funny story that when I was as young as 5 years old, she always used to tell me that I would not have dinner unless I had a salad beforehand. So it's so interesting. And as a 5-year-old, how do you know that? And sometimes we're just instinctually inside of us. We know certain things are better for us. So I've always had this mentality of, being healthy. And one of my biggest influences, believe it or not, I never met before, personally. Very important person in my life, but he unfortunately was unable to be in my life for a majority of my life, and that's actually my father. So my father passed away with the heart attack at I was 9 months old, so I really don't have one memory of him. But, I didn't realize that he was such an influence on me until recently, because when you grow up, you didn't have a father. That was my thing. Like I grew up, my mother was my caregiver, and I had an amazing family that also helped out with that. But for me, recently I realized that I think that subconsciously put in my brain, like, my father died at a young age, so I'm going to do all in my power to learn and teach as many people that I could about healthcare and how to be healthy so that they don't have to experience what I experienced, is growing up without a father. So it's really interesting how I didn't discover that until probably the past 2 or 3 years. I've had other influences that were amazing in my life. I could have a whole podcast on all the influences in my life. But I think that drove me, even as a young child, that I may not have realized it, but subconsciously, like I always wanted to be healthier because of that. And so that obviously got me on a path towards, I started off thinking I was going to be a personal trainer. I actually went to William Patterson University out here in New Jersey, and I studied exercise science. And exercise science was my thing. Like I started working out when I was about 14 years old, and I even trained my high school friends in my garage. Like, so I always had a caregiving aspect of my life. And then that turned into me learning about chiropractic through a very close family member of mine. His name is Dr. Dean DePice. Some people in the community might know him. He was a very strong influence on me. And with him, that gave me the interest in chiropractic. And then I started to look more into it, and I found my first chiropractor. His name was Dr. Nick Stabile, and he kind of put me in the direction I needed to go. Then I went down to Life University, graduated from there, and then I always had this inner feeling that no matter what person comes in my door, I want to be able to help them, whether they're a teenager, a child, or an older adult. So in addition to my chiropractic education, I always made sure I was doing outside of chiropractic class education. So I did extra courses on postural corrective care. I did extra courses on neurology. I did extra courses on childhood developmental disorders and metabolic disorders. So I made myself very knowledgeable right out the gates because I wanted to make sure I knew how to help everybody. And then, interestingly, all of this knowledge that I had, I could say I lived a pretty decent life, a pretty healthy life, I should say. And then about a year ago, I got a crazy diagnosis my way, and I was diagnosed with type 1 diabetes, which was unheard of in my brain. Like, how could somebody who lived the lifestyle that I lived develop type 1 diabetes? And that got my wheels turning even more as somebody who likes to learn. And I'm like, what the heck's going on? So I did my own research. I found out all about what causes type 1 diabetes. I figured out autoimmunity, and I did my own personal testing to find out why my body changed from quote-unquote being healthy to now autoimmune and type 1 diabetic. So the lifestyle that I was teaching people to live, now I have to live 100% and maybe even more. So I think that gives me a unique background to be able to help others because I could relate to them. I'm not somebody that's just reading from a book and telling them this is what the book says. Like, I know what's going on in my body, and I know what type of sensitivities I had to foods, and I know what type of things I had going on in my digestive system that was not allowing my body to function at its best. So with that, I used that experience to drive a lot of the recommendations and the things that we do with a lot of the children and adults that we see.
Yeah, so you discovered there were some areas, what I hear you saying, I mean, that's a remarkable story, really, all those pieces. And so even though on the surface you were living a healthy lifestyle, there were still some things that maybe you weren't attending to or aware of that kind of built over time that led to this autoimmune situation is what it sounds like. And so you had to dive in deeper. And so how's that going now?
I have it under control. It was a year ago, so it's still very new.
Right.
But most type 1 diabetics are recommended to take a long-lasting dose of insulin that kind of gives them a baseline of insulin to help them, and then they're recommended to take a short-acting insulin with each meal. So I've gotten my lifestyle and my dietary habits to be so clean that I really only require the long-lasting basal insulin throughout the day. And then with my meals, I actually don't need insulin. Because, when you go into the world of diabetes, carbohydrates are a big driver to blood sugar fluctuations. So I'm on a very, very low carbohydrate diet that really doesn't have my blood sugar fluctuating up and down. So the fact that I'm only on a nighttime dose of long-lasting insulin and nothing throughout the day, the endocrinologist that I was seeing, who is a medical doctor, actually is confused. He's like, I don't understand how you're doing it. He actually did a special test on me. He put like this chip in my skin, and it tested my blood sugar every 5 minutes. And he's like, I want to see throughout a weekend what your blood sugar is doing because I think you're spiking and you don't realize it. And I'm like, all right, do it. Like, I'm cool. I checked my blood sugar. I know what's going on. And all through those 3 days, I lived my lifestyle, and it actually was almost baseline. I mean, there was little fluctuations here and there, but he was like, I guess this is proof. Like, whatever you're doing, keep doing it. I'll see you in 6 months, and we'll monitor you as you go along.
Wow.
So, and this lifestyle that I'm living is not being taught to type 1 and type 2 diabetics. I mean, type 1 diabetics are in children. A lot of type 1 diabetics are young of age. So if they're not being taught correctly, they're going to develop a lifestyle that isn't ideal for their condition.
Yeah. Yeah. Well, that's fascinating. I mean, it definitely sounds like something, the way you've understood it and been crafting your life is something that is vital, really should be taught to people out there who, parents particularly who have kids that develop type 1 diabetes. Because, like you said, most often it happens at a young age. I have a brother-in-law who was 5 or 6, I think, is type 1 diabetic.
Yeah.
And since it's October and that's ADHD Awareness Month, nationally here, I brought you on in particular to share some of your specific expertise related to that. And maybe we look at scheduling another time to talk more about the type 1 diabetes stuff too, because that'd be cool to dive deep into that. And so I'd love to just get a couple points from you with your particular background in studies in neurology and then with the childhood developmental disorder stuff. I'd love to have you talk a little bit about how our eating habits and lifestyle and nutrition habits, like what that step is, how that affects the function of the brain, and why do we see these things that we see when kids have their diet habits change. Often we will see improvements in school and behavior and all these problems that are associated in focus and all that stuff with ADD. And it sort of makes sense, like, food, okay. But I'd love to just kind of dive a little deeper into how that actually happens, how that functions in our body. And then maybe with that, take out of that understanding to help parents, be able to make some different choices and understand why the foods affect their kids in different ways.
Absolutely. So the one thing we need to understand about ADHD and children with developmental disorders, it's a multimodal disorder. There's not one thing that causes it. So you have a neurological aspect of it, but you also have a chemical aspect of it. So everything that we put in our body is going to affect our body in either a negative or a positive way. So one thing that, especially in the world of childhood developmental disorders, one thing that a lot of children are dealing with, and they don't even realize it, is food sensitivities. And a food sensitivity is very different than a food allergy. So people hear the word food sensitivity and they automatically think an allergy where, you have a peanut and your throat swells up and you can't breathe. That's an allergy. A food sensitivity is a little bit more subtle. It's a sensitivity where you have that food, yet that food maybe gives you a headache, or maybe it raises your temperature in your body, or maybe an hour after it makes you have to go to the bathroom. That's more of a sensitivity rather than an allergy where people know they have an allergy. And the most common things that children are sensitive to are gluten, dairy, soy. And for me personally, with my story, I was severely sensitive to gluten. But the crazy part about it is most people think of gluten sensitivity and they think of celiac disease. Meaning that if you go to the doctor and they test for celiac and it comes back negative, they think they're not sensitive to gluten. Well, that happened to me. I went to the doctor, they tested me for celiac disease, and I was negative. I took a more comprehensive test for gluten sensitivity, and I was off the charts on other strands of gluten that could affect you. So there's other strands of gluten that could affect your body in different ways. One, attacking your cerebellum, which is the brain, part of the brain that is your balance and coordination center. It's your postural, it controls your postural muscles. So, if you have a disorder where you're having neurological issues, it could 100% be from a sensitivity what you're putting in your body. Not to mention that those type of foods are very inflammatory to the body. When you have inflammation in the body, especially in the gut, it causes what's called a leaky gut. We have these tight junctions, they're called, in our stomach, and those tight junctions are like doors that stop certain bacteria and certain things to get from your stomach to your bloodstream. So those doors need to be tightly shut. unfortunately, when you have inflammation, it slightly opens up those doors, and it allows things to go from your stomach out into the bloodstream. Those things could be proteins from the gluten. It could be bacteria. And when that occurs, an autoimmune reaction starts to occur because your body says to itself, this should not be in my body, and it starts to attack. And it could attack anywhere in your body. It could attack your brain. It could attack your thyroid. It could attack your pancreas. It could attack your stomach. So a lot of times, these children have those sensitivities, and they don't even realize it. So the number one thing I would recommend anybody that's dealing with that is get the sensitivity testing. And don't just go to the doctor and get just the regular medical testing. There's multiple companies out there that do great comprehensive food sensitivity testings. They test for gluten, they test for soy, they test for dairy, they test for multiple other ones. And that's really what you want to find out, because if every single day they're eating something that their body's sensitive to, well, that's going to drive the disorder. Especially in the day that we live in now, the society we live in now, carbohydrates and sugars are so popular, especially in children. They love their cookies, they love their cakes, they love their cereals, they love their bagels. And unfortunately, those, when put in your body, turn into sugar. Glucose, we could call it. So when you have that much glucose in the body for a child, it can make them very hyperactive. So that type of approach to start is a good step in the right direction. Then you could always obviously talk about the neurological aspect and what type of treatments you could have that way. But even just on a nutritional level, getting to the level of, is my child sensitive to any food? That's the first step forward. And then based on that, you can choose the right things to put in their body and not to put in their body.
Gotcha. So what would be the things that a parent would look for in terms of, like what the test is called or what they're testing for, or that type of stuff, if they're looking for the right test?
Absolutely. So there's two companies that I use. One is called Vibrant Wellness, and Vibrant Wellness has what's called Wheat Zoomer. It's called the test, and it tests for leaky gut as well as wheat sensitivity or gluten sensitivity. So beyond that, there's another company called Cyrex Labs. And Cyrex Labs, they have different arrays. I forget the exact number that they use. But there's a gluten sensitivity one and a gluten cross-reactor sensitivity test, meaning that certain nutritional supplements, or not supplements, products could be cross-reactors to wheat. Meaning they might be shipped in the same type of shipment, or there's just a cross reaction that they could be sensitive to that as well. So those are two that I recommend: Vibrant Wellness, as well as Cyrex Labs.
Okay, great. So, and is that something that a parent would need to go through a healthcare provider, or can they just do those tests like if they get online?
They do have to go through a provider, because the provider will have test kits. Okay. So they have to take that test kit, and then they'll get a requisition from the doctor. So they do have to order it through the doctor. Gotcha. And then they'll take that test kit to a local laboratory, and then the laboratory will take the blood work, put it in that test kit, and it gets shipped out to, at least for Cyrex, it gets shipped out that way. Gotcha. So for Vibrant Wellness, it's more local to New Jersey. So they actually have a phlebotomist that will come to your office or come to their house even and take the blood work that way. So that's why the Vibrant Wellness is more localized to this area. That's why I've been using that, and they've been awesome.
Yeah, that's great. That's great. So then, just to follow this a little further, you're talking about some with the leaky gut and some of that autoimmune reaction with that. What is there a how does that affect? Like, so we have that going on, and we have this autoimmune thing, and our immune system is now fired up, and we have this inflammation. How does that happen or affect in a kid and cause them to have a hard time focusing at school? Like, what's the link there?
Yeah. So research has shown there is actually a gut-brain connection. So if you have issues with your digestive system, you can have neurological changes. Those neurological changes could manifest as ADD, ADHD, dyslexia, depression, etc. So that's really huge to understand, that your dietary lifestyle could totally be driving the negative thoughts or the emotional thoughts that we have in our brain. So just like we have a leaky gut, quote unquote, you can have a leaky brain. There's a blood-brain barrier that also could be compromised with these inflammatory lifestyles. So in addition to things being able to go from the stomach to the bloodstream, you can get certain things that should not be in that brain going from the blood-brain barrier to get into that area. So that's how that could affect the neurological function, because then you start getting inflammatory effects in the brain. And a lot of people describe the feeling as like almost like a fogginess, like they feel foggy, like they can't focus, like around them isn't clear. And that's really something that is more developing over the past years of more understanding of brain function and how nutrition affects it, and starting to get to know what's causing these neurological disorders. Because it's amazing. I mean, ADHD is, any disorder that we get is a label on a symptoms that we show. So ADHD is symptoms in a childhood that might be hyperactive, it might be attentive issues, and they get labeled with that. But that's no different than, say, an older adult that gets diagnosed with Alzheimer's or something like that. It's just a set of symptoms that they got as their diagnosis. The underlying issues are still the same. You have a sick body. The body is not functioning at its best, whether it's due to emotional stress, physical stress, chemical stress. And that's really the one thing that needs to be looked at in everybody's lives. And obviously in children, they're developing, they're growing. You want them to be the strongest that they can be.
Right. Yeah, so not to say that having trouble in school or having difficulty with relationships isn't a big deal, but what it sounds like you're saying is that there's a whole nother level to how big of a deal this problem can be. That it could be, injuring or damaging the developing brain, beyond just they're getting bad grades at school. But,
Yeah.
I don't know if there's research or, about, causing like long-term damage or, I hate to say permanent, but, long-term problems if this isn't ferreted out, early on.
Mm-hmm. Yeah, you got to think it's just like a smaller injury. Let's not think of it as a neurological injury, a small injury. If you have an injury of a certain part of your body and you never correct that, and you keep doing things to that area of the body to injure it, that injury is going to progress and potentially turn into something larger. So it's not really just, this is happening during the childhood times. If it's happening in the childhood times and not correctly addressed, that turns into a child with neurological compromise to an adult that's compromised. So it could totally translate into the lives, as they grow older, and affect maybe their relationships that they have, affect their ability to get the jobs that they want and stuff like that. So addressing it early is the most important thing.
Right. So now you mentioned food sensitivity, getting a real test on that. And obviously if you're sensitive, then, make the changes necessary there. What would be sort of the next step beyond that? Like once you've handled that piece, what else do you talk to parents about doing with their kids to take the next step in helping improve?
Yeah. Obviously, and this is a tougher one for people, but the way you communicate with the child is important. They have to feel like they're being heard as a child. Sometimes the parents just want to be parents and just talk to them in a way that they want to, get the result they're looking for, whether they want to control the situation. But sometimes a child that's acting out is really a child that's asking for help but doesn't know how to ask for help. So really getting an understanding of what they're really looking for, what's really causing them to act out in a certain way. Is it really that they have these neurological issues that are making them act out, or is it something else that maybe they're not addressing and they need to be heard? So kind of almost sitting back and not being that mother or father figure and just being somebody that they just need an ear to talk to. So communication is a big thing, which is not what a lot of people think about. They just think automatically, they have some type of condition. Well, let me think about nutrition and let me get them on some type of medication that'll calm them down. But they don't think that sometimes it might not be a neurological issue. It might be an emotional issue that not is being addressed, if that makes sense.
Right, absolutely.
So communication is great. So, learning how to communicate with the child is important, and not always going into that protective mode of I'm your father or mother and what I say is the right thing. Sometimes what you say may be the right thing to you, but to that child, it might feel like to them that you're trying to control them, or it might be that they're trying to not allow them to do what they want to do and be with their friends and robbing them. Like, I mean, there's so many different areas that they could go. So sometimes you just have to sit back for a moment, get out of protector mode, and actually listen to the words that are coming out of the mouth, because they'll actually tell you without really telling you. So that's a really powerful way of getting to know them, because sometimes when they get heard and they really realize that there is an emotional thing that could be involved, they could actually stop acting out as much as they did, in addition to other aspects as well.
Right. And I think that's a really important point, because, one thing that I hear brought up a lot in the kind of the natural healing alternatives world is that a lot of these ADD or ADHD diagnoses are actually misdiagnoses. And so what we're really touching on is the potential that, if you're a parent with a kid who has, either been diagnosed or not diagnosed, and you think that might be what's going on, that it might not be something neurological. It might not be this autoimmune or leaky gut. It might simply be there's some things in their life that aren't going well for them, that they need to express about, or they need to have change. Something could be happening at school, a bully, who knows what. But if you listen and then you can start to work on those pieces as well, as the nutritional side of things too. So I think that's a really valuable point. And then there was another thing you mentioned when we were talking about the leaky gut and the dietary stuff that I'd love to come back to just for a little bit more, because you mentioned sugar as well. And so can you speak a little bit more about the effects of sugar in terms of some of this neurological or the gut-brain connection or behavior and that type of stuff?
Sure. I mean, sugar in itself is it drives blood sugar up and down. So sometimes if they have too much sugar, they could get these high spikes of glucose in their body, and then that's going to give them a burst of energy. But then on the reverse end of it, it really drops down. So, sometimes, they might get irritable or might get very, bothersome when they have low blood sugar, because they're looking for that glucose spike. So when you have that sugar, you want to make sure that it's not a high amount of sugar, and it's not just sugar like table sugar, like most breads and pastas and sandwiches and all that stuff, that all turns into glucose in your body. So a lot of people think, I won't use a lot of sugar, I won't have a lot of sodas, but even the foods that they're eating turn into glucose in their body. So that's important to know, and that's almost like it has the same equivalence as like cocaine and stuff like that. It's addictive, so it goes to the same brain centers, and it has the same type of aspects of this energy boost. So they literally get addicted to the sugar, and that unfortunately can cause a vicious cycle of they have to get this sugar in them, or they're really depressed, quote unquote, because their blood sugar gets so down. So if they get on that cycle, it's very hard to get them off of it, and then you got to realize what it does to the stomach with the inflammation, and it causes leaky gut, and we could get these autoimmune processes. I mean, it really is something that drives disorders, whatever it is. So that's definitely something you want to look at, is looking at how much carbohydrates they're having in their body. And when I say carbohydrates, I mean more of the bad carbohydrates, because you have good carbohydrates. You have your vegetables are great carbohydrates and stuff like that. So, but even think about just the daily dietary lifestyle of a child. They wake up in the morning, they typically have some type of cereal or a waffle or something like that, which is full of carbs. Then they might have a lunch that either is going to involve maybe macaroni and cheese or a sandwich or something that, again, has a lot of carbohydrates and dairies. Then at dinner, they might have their best meal at dinner because the mother or father is trying to give them a good meal at that point. So maybe they'll have like a chicken or steak or something like that. They might have something else. But if you just look at it, most of their diet, I would be confident to say probably 60% of their diet, 70% of their diet is carbohydrates, which then is just going to drive so much glucose into the body, and then that could just totally cause neurological compromise, gut compromise, et cetera, and drive this in the wrong direction.
Yeah. Well, I mean, that sounds like the majority of what people eat. When you say gluten, sugar, soy, and dairy, I mean, that's the standard American diet right there. The soy being in all the soy oils, vegetable oils and stuff they put in everything. And so then now, you're talking to a parent who's like, okay, I get it. There's this big problem. Mm-hmm. I need to make a bunch of changes with my kid. And, but all of those things you just mentioned, that's basically all we eat. How do we get started? Because that can be certainly overwhelming. And if we're overwhelmed, then often we'll not make the changes, So how do you help people kind of get the ball rolling in terms of making
Yeah.
some of those changes?
Yeah, and that's a very sensitive subject, because changing a diet on anyone is difficult, let alone changing the diet of a child. So this is definitely a sensitive question or sensitive conversation. But I mean, the first thing I could do is, because it does sound overwhelming, I would just start with just doing one thing at a time. So like maybe just focus on one meal. Like let's say breakfast. It's better to have a breakfast that is higher in protein and fat than it is in carbohydrates. So maybe change their breakfast first to something that's higher in that protein and fat. So then at least they start their day off with a more balanced blood sugar, first of all. They have a more sustained energy, and it's not going to give them that jolt of energy. So just start one thing at a time. People get overwhelmed because they start thinking of all the things they have to do. If you just step back for a second and just say, all right, well, let's just do one thing at a time. Today, let's change the breakfast. And then the next day or the following day after that, maybe you could change the breakfast, and then, oh yeah, let's maybe look at the snack that we're giving them. Are we giving them potato chips and cookies, or now we could change to maybe let's just give them something that's better for them, like an almonds or something that's higher in fat or protein, because it's a better source of a snack. So just try to do one thing at a time. You're not going to change everything in 1 week. It might take 6 months or a year or even years to really get to where you want them to be. But as long as you take it in small steps, number one, it'll be easier for the parent to handle, and it'll also be easier for the child to handle, because it's not like, Mom, Dad, you just changed everything about me. Like, I love all this stuff. Like, just do it one step at a time, and that's really where it's going to be a little bit more of an easier transition.
Yeah, that's good too, because you think about in a lot of these cases, part of the desire to make these changes are to affect behavior, and then if all of a sudden you pull everything, shift everything on them, that's going to just fire up all of that stuff. You know what I mean? And
Yeah.
not allow for that. So I think that's a great point. Is to do it step by step and understand it doesn't have to be all at once. And even what you're saying about a year or months or years to make those changes, that makes it definitely seem a lot more doable. If you're kind of, because I work with a lot of parents in my practice who have kids that have different attention issues, or even on the autism spectrum, or different developmental issues and stuff like that going on. And I'll tell you, one consistency through all of these parents is they're basically in a state of overwhelm all the time. It's a huge thing. And so to take somebody who's in that state and say, okay, change everything, it's like there's just no inbox. Even if they think it'll be a miraculous change, there's just no way to do that. So I definitely appreciate that.
And a huge thing besides that is also hydration. A lot of kids and just adults even are chronically dehydrated, and they don't realize that they're supposed to have a certain amount of water per day. So that's a huge thing, because a lot of kids, rather than having water, they're having their juices and their sodas and all that stuff, and that's also driven with sugar. So not only are they physically chewing and eating their sugar, they're drinking their sugar. And the number one thing that's in most drinks, especially if they're sodas or dietary supplements or dietary sodas, is artificial sugar. So there's aspartame and the sucralose and all that stuff. That's all very unsafe sources of sugar as well. And that could even drive the effects as well. So it's not even just what you're physically eating, it's even what you're consuming on a hydration level. So, we use the hydration formula of half of their body weight in ounces of water per day. So if you have an 80-pound kid, they should have at least 40 ounces of water a day. And if they're having sugar in addition to that, they have to increase that, because that's dehydrating them more. So that's a huge part of it that a lot of parents don't realize, and even adults don't realize, that hydration is important.
Yeah, well, a lot of the things you see, or that people drink, are, like you said, dehydrating. And now, in the last, whatever it's been, 15 years, the proliferation of all the energy drinks too. That's all full of all that stuff, artificial, regular caffeine, all that stuff. And we're seeing younger and younger kids drinking those things too. So, that certainly can't be helping the situation for sure. Well, yeah. So okay. So we got food sensitivity, and then looking at sugar and seeing where we can make those replacements and start adding proteins and fats into the diet. in a stepwise manner in hydration. Any other sort of beginning tips that come to mind, or what the next step would be?
Yeah, I mean, to be a little bit more specific, a great diet that is good for these type of children and everybody else as well. It's the diet that I'm personally on, and it's really up and coming, although it's been around for a while, is a ketogenic diet.
Uh-huh.
A ketogenic diet is a diet that's high in fat, moderate in protein, and then very low carbohydrate. They want you to have as low as 50 grams of carbs a day. And if you look at the diets that most Americans live, they sometimes have 50 grams in one meal. So to change that is very difficult for some people, but not only is that good for the brain because it decreases inflammation and all that stuff, but it even changes the source of energy that it's needed. Like the brain loves its energy source to come from fat and ketones. So the difference between a ketogenic diet and the all-American diet is the all-American diet relies on glucose as its energy source, meaning that the glucose or the sugar that comes from the foods they're eating is what's dedicating how much energy they have. And the thing about glucose is it's very short-term. You get a big spike and then you get a big drop. So it's an inefficient source of energy, although it is a source of energy. When you have a higher fat and protein diet and less carbohydrates, your body needs to start to burn the fat and protein, and it starts to use what's called ketones. Well, now ketones are a more longer-lasting, efficient source of energy, and it's also great for the brain. So that's a way that once you change that and alter that, that's a specific diet that they can look into to help transition out of the normal diet that they've been dealing with. So that was life-changing for me personally, and also obviously there's a lot of research starting to come out that how this is really helping with a lot of other disorders, neurologically, cancer-wise, diabetes, etc. That's a whole conversation we can have as well. So that diet right there is one that I would recommend people look into, is a ketogenic diet. I mean, there's a million sources out there nowadays, especially within the past year or two. It's really becoming popular.
Right. Yeah, so definitely seen it everywhere.
So that's another one, and it's actually a diet that once they get over the hump of getting over their withdrawal from sugar, it's such a great diet because you don't get that sluggish tired feeling throughout the day. Where a lot of these kids halfway through school or halfway through the day they're exhausted. They just want to take a nap. And because their levels of sugar are just spiking up and down, and it's not sustained. So that's a huge thing that they could look into, is that ketogenic diet.
Yeah. Well, also, I mean, in food, fat is a lot of where the flavor is, right? So it's not you're not telling them they got to eat kale all the time, right? They're eating things that they probably like to eat, once you get over that sugar addiction. So, I mean, that's one thing that seems doable about some of the ketogenic principles is, it's a lot of stuff that we used to think, or we've been taught, for the last 50 years or whatever, are bad for us, But so it's you get to eat all that stuff again. So that's a good thing about it.
Exactly.
Yeah. Well, so definitely I can imagine that, based on what you've shared today, that there'll be a lot of people listening who want to find out more, want to explore different topics more, maybe learn more from you. What would be the best place to do that? How would they reach you and contact you?
Sure. I mean, I'm very active on social media. So I have obviously my business page. My business is called The Chiropractic Source. So you can look up The Chiropractic Source on Facebook. But I also have my own personal one that I'm able to share a little bit more personal stories. So it's Dr. Marco Ferucci on Facebook. And then on Instagram, the younger folk will like that one. Instagram, it's Dr. Marco_Chiro. And on YouTube, we're The Chiropractic Source on YouTube. So we're very social media driven and active. So those are great ways. And then our website is thechiropracticsource.com.
Great. So
those are great ways of getting in touch with me, and I'm always willing to teach and educate. I mean, that's a part of what I do. It's part of my love.
Right. Yeah. Well, thanks so much for doing that with us today, getting on here and sharing and teaching some of your expertise. I know it'll make a difference for, a lot of those parents out there that are looking to really help their kids, whether they have ADD or not, honestly. I mean, that's just the focus this month, but our general focus at, Kids Eating Broccoli is to help change that direction that the young generation is going in, on a whole, where their health is going downhill, and we want to do our part to really help change that, because we know parents aren't feeding their kids crap because they don't care. They maybe don't know what to do or how to do it. So that's a big part of our goal, is to really help, establish that, because we know that, all those kids have the ability to be healthy and be, wonderful, humans and express themselves creatively. And so we just need to kind of guidance on that way. So I appreciate you taking your time with us today. Thanks so much.
Excellent. Thank you so much.
If you enjoyed this episode of Kids Eating Broccoli podcast, connect with us online. You can find us on Facebook at Kids Eating Broccoli Podcast or at Dr. Brad Ellisor DC. You can also go to our website, drellisor.com. That's DoctorEllisor.com. Go to iTunes and leave us a review and a rating, or on Stitcher. And be sure to keep in touch with us so you can hear the next episode. Sign up for our mailing list or like us on Facebook. You guys take care now, and let's make the next generation the best generation.